You ever wonder about that nagging ache in your knee or that stiffness in your back that just won't go away? Well, in this explainer, we're going to unravel the puzzles behind the pains that affect so many of us. We're going to look at everything from our joints and muscles right down to our bones. You know, most of us have been there at some point. A stiff knee, a sore back, muscles that just feel weak for no reason. But what if those feelings are just the tip of the iceberg? Figuring out what's really going on under the surface, well, that's the critical first step to actually managing the problem and getting back to feeling your best. All right, let's get into it. Here's our game plan. We'll kick things off with the common signs to look for. Then we'll dive into the two very different faces of arthritis and try to make sense of widespread pain. After that, we'll uncover a silent disease and wrap it all up with how movement itself can be the best medicine. So let's start by playing detective and identifying the clues our bodies are giving us. These are the common signs that signal something might be a little off with our joints, muscles, or bones, no matter what the specific diagnosis ends up being. So what does this stuff actually look like? Well, impaired mobility can mean something very specific, like a capsular pattern. That's just a fancy term for a predictable loss of movement. For example, you might be able to bend your shoulder forward, but you can't raise it out to the side. Then there's muscle performance. Pain can literally tell our muscles to shut down, which leads to weakness. And this messes with our balance too. See, our joints have tiny sensors that tell our brain where we are in space. When that signal gets fuzzy, we get wobbly. And all of this, of course, really limits our day-to-day activities. Okay, now that we know the common signs, let's look at one of the biggest culprits of joint pain out there, arthritis. It's a word we all hear, but it's so important to understand that it really has two very different faces. At its core, the definition couldn't be simpler. Arthritis literally just means joint inflammation. But, and this is a big but, where that inflammation comes from is what splits it into two completely different worlds, the inflammatory autoimmune world of rheumatoid arthritis and the non-inflammatory degenerative world of osteoarthritis. And this slide just lays out the contrast perfectly. Think of osteoarthritis, or OA, as a mechanical problem. It's basically wear and tear, like the tread on a tire wearing down after years of use. It usually affects just a few weight-bearing joints, and it's asymmetrical, so your right knee might be bad, but your left is fine. Rheumatoid arthritis, RA, is a whole different animal. It's an autoimmune disease where your body's own immune system gets confused and attacks the joint linings. It usually starts earlier in life, hits many joints symmetrically, so both wrists or both knees, and it brings along systemic symptoms like fatigue and fever. And that brings us to a really crucial point. When RA is having an active flare-up, the game plan completely changes. The goal is to protect the joint, not to push it. This means things like gentle range of motion to keep things from getting too stiff, and isometric exercises. That's where you tense a muscle without actually moving the joint to stop the muscles from getting weak. It's really all about calming the storm.
Okay, so we've talked about pain that's located in a specific joint. But what happens when the pain feels like it's, well, everywhere? Now we're shifting gears to conditions known for causing that kind of widespread chronic pain that can be so much harder to pin down.
This chart does a fantastic job of showing the key differences between two conditions that often get confused. On one side, you have fibromyalgia. That's a systemic problem defined by pain all over the body, those specific tender points, and just profound fatigue. On the other side, you have myofascial pain syndrome. That's a regional issue. It's all about specific trigger points in a tight muscle that cause pain, but it doesn't come with all that systemic fatigue. And let's be really clear about what a trigger point is. It's not just some random sore spot. No, it's a very specific, super irritable knot inside a muscle. And here's its signature move. It can refer pain somewhere else. That means pressing on a knot in your shoulder muscle could actually be the cause of your headache or that pain shooting down your arm. All right, next up, we're going to talk about a condition you often can't see or even feel. That is, until a bone breaks. Osteoporosis is a silent disease that weakens our bones from the inside out, making them dangerously fragile. And the scale of this is, well, it's just enormous. 10 million Americans are living with osteoporosis as we speak, and a staggering 80% of them are women. This puts a huge number of people at a high risk for really debilitating fractures of the hip, spine, or wrist. So what is actually happening inside the bones? Well, imagine your bones have this dense internal scaffolding that gives them all their strength. Osteoporosis is what happens when that scaffolding gets thin,
porous and brittle. The official diagnosis comes from a bone density scan, where a T-score of -2.5 or lower means the bone has become dangerously weak. But here is the good news. This is not inevitable. Prevention is incredibly powerful. The National Osteoporosis Foundation gives us these 5 crystal clear steps. It all starts with the right diet and weight-bearing exercise, and it includes making smart lifestyle choices and, of course, talking with your doctor about getting tested if you need to. Okay, for our final section, let's bring all these ideas together and really focus on the single most powerful tool we have for managing all of these conditions, and that's thoughtful, appropriate movement. This quote right here, it's so important. It highlights a critical takeaway. For something like RA, exercise isn't going to cure the autoimmune disease itself. But that's not the goal. Its true power is in maintaining function. It helps correct muscle imbalances, it preserves your mobility, and it ultimately lets you keep living your life as fully as possible. So the big takeaway is that the way you exercise has to be intelligent. It's about working smarter, not just harder. As you can see from these principles, it all comes down to listening to your body, breaking up your activity into smaller chunks, and avoiding putting unnecessary stress on your joints. It's about finding that perfect sweet spot between a healthy challenge and staying safe. By understanding the what and the why behind all these aches and pains, we become empowered. We can go from being passive victims of our symptoms to being active participants in our own health. Everything we've covered gives us the tools to make informed, proactive choices for ourselves. And it all starts with this simple question.